Welcome to my podcast. Today I'm going to talk about another common case that can be faced in the primary care health or in back home. We usually used to see it in a specific clinic. So basically, after you introduce yourself, as we always agreed, and double check the patient name and date of birth. So the patient will be like a female or a male. Who would say that, doctor, I'm having persistent itchiness in my feet and just killing me and it's bothering me and I don't know what should I do. I used some of the OTC medication, but nothing has worked and I'm not quite sure what's going on. So you tell me more about it. So if the patient started to say it has started since 2 weeks time or a week time or 10 days and it just started as a small spot that I didn't pay attention to and then gradually started to increase and it's really itchy and I don't know what's going on. I made my own search and I'm not quite sure what's that. So I tell her, have you used anything so far? If she has used, what sort of things that she used? Usually the patient will tell you if they have used something or they brought it with them in order for you to inspect and double check what was the medication being applied. And then you will ask her, is it your first time? What's your thoughts, idea about what's going on? If you have any thoughts, because sometimes the patient might say what was the main culprit. And then you will ask the patient if you have any past medical history. The patient will tell you that I'm having psoriasis, palmoplantar psoriasis, and I've been taking medication for some time. It's on and off. Sometimes it's okay, sometimes it's just relapsing, as we would expect in psoriasis because it's a chronic skin problem. However, nowadays it can affect anybody in the body and being declared as it's a metabolic syndrome. And you will ask, if you have any, for instance, history of diabetes, hypertension, medication-wise, what do you take? The patient is only receiving ultraviolet light in the hospital, so three sessions per week. And you will ask her, do you have any family history? She will tell you, yes, I do have my member of family, the close one, they have psoriasis. So obviously it's a familial issue in the family, so it's genetic. This gave us some idea what's going on. And then you will ask her, do you have any known allergy at all? Do you have PITS? What sort of lifestyle do you do? What kind of a work do you do? All of this to give you an idea, because maybe the patient has been working in certain situation where might exaggerate her condition or precipitate any other factors. And then you will ask her, whom do you live with? What's your marital status? Just to have an idea what's going on. And then you will ask her, I would like to have a close look, if that's okay with you. I'm going to have a chaperone, if it's opposite sex. And then you will see that she has well-demarcated red rash and yellowish nails. So you start to think what might be the differential here. And you need to ask about certain risk factor. As I say, what sort of a work does she do? What sort of footwear does she use? What's the environment situation where she works, if it's a wet situation or a dry situation. And as I said, the footwear. So based on that, you will build up certain differential in order for you to come up with the diagnosis that you agreed with the patient in order to manage the situation. And also don't forget to ask about if she has a pet, for instance, a dog or a cat, because some people they have cats and pets in their home. So you will just ask all of that, if she has any allergy, as I say, or have asthma as well. And then you will just think about some differentials. Say, for instance, if it's fit with the tinea, for instance, or a fungal infection, like tinea pedis. This basically you will send for scraping. It's a clinical diagnosis, but sometimes can be confused. If it's, for instance, superseded by topical steroid, obviously the patient will tell you she used OTC, and one of that is steroid. especially if it's a strong one or a medium strength. So you will send for scraping. You will do basically this one called itch. And if it's not clear cut, you will send for a biopsy. And the other thing you would need to think of, which is itchy as well, it is called eczema or dermatitis, which usually is a coin-shaped skin lesion, red and scattered, usually in the legs and arms, and it's quite extremely itchy or very, very pruritic. The other one you will think of is, as I say, the patient is being diagnosed with psoriasis, so it could be palmoplantar psoriasis. And if the patient used topical steroid, this could precipitate also fungal infection. And from the history, I said that she has a yellow nail. So that could fit as well. The other thing you could think of, because usually all of those differential, they have a characteristic round red skin lesion. So it's another thing that you think of. It's granuloma annulari, which is a ring-shaped lesion with the breast clear center. Sometimes they have the shyness at the peripheral, and it's also extremely itchy. So you will, based on that, tell the patient what's your differential and how you're going to take things and move it forward. So you'll tell her that we need to stop your steroid. Obviously, if she's taking topical steroid or oral steroid for whatever things. And you will give her topical antifungal infection, any antifungal that you have. And sometimes you might give oral steroid just for a few days to minimize the inflammation or shut it down. So she will use it like the antifungal cream. She will use it for like 3 to 5 days. And you will advise her about certain things that she needs to do, for instance, to avoid the humidity, wet situation, and occlusive footwear, because this will increase wetness and it will increase humidity in the feet, and it will cause also exacerbation of the fungal infection. And also advise her to wash feet and dry them thoroughly, and especially between the whips of the toes, because that's a common place whereby candida or fungal infection will be harboring and will exceed after that. And the other thing, of course, you're going to give her follow-up time, so in order to manage and check that the patient is improving and making an improvement. And then you'll red flag her if the condition does not improve, if you notice that the condition is increasing or any of that, you just need to come back immediately, and we will see and manage things accordingly. So by that, I hope that I covered one of the most common cases that usually we see, whether in primary care health provider or in the hospital setting or in the community as well, and how you can approach and treat it accordingly, because if you miss the diagnosis and give the patient something like steroid, you'll just put the patient into much agony and itchiness. Thank you.